which keeps a balance to keep the tear film functioning well, because when light hits your eye, it first has to hit the tear film, then hit your cornea, then hit the lens, and then go inside the eye. So this tear film is very, very important for us to be able to see clearly. So a healthy tear film is important for optimal, that is great vision, and it also acts as a protective layer for us. So the tear film has a lot of functions in it. It is part of the refractive system because you need a nice shining clear surface in front. The lipid, which was that oil layer, it provides lubrication, it stops evaporation. And the mucin, which was the protein layer, it reduces shear forces related to the blink cycle. So a little more complex here. We're going into what the tear film is. So how does all this work? So the lipid layer, it protects the inner surfaces by being an oil. So it's protecting your water layer from evaporating, which is the first. You remember the three sections: the protein, which is right against your cornea, the water in the middle, and the oil in the front. So remember, oil is going to act like a protective layer. So it protects and prevents the drying up of the water layer of the tear film. It also protects against bacteria, and it helps to therefore protect your eye. Now, what else does the tear film do? The tear film helps to maintain the pH of your eye. So how comfortable your eye is feeling, whether there is burning or jalan, what you call, and things like that. Okay, so it gives a protective layer. It helps to maintain the environment of the eye. So how are tears produced? So we've got this gland sitting on the side. So here's your nose on this side. So this is the eye. And here on the outer side of the eye is the lacrimal gland. The lacrimal gland is producing the water part of your tear film. Okay. And this water part, based on the blink reflex, this water gets spread across your eye surface, and it actually drains out from two little tubes at the inner corner of your eye, and from that tube it goes into the nose. And therefore, if you think about it, when you cry, why does your nose run? It runs because there is this tube mechanism which is taking the extra water of your eye and taking it into the nose. And how does the tear film get spread? Your lids, your eyelids, the upper eyelid, it comes down and goes up. So it acts like a wind, the windscreen wiper on your car. So it acts like that. But in the eye, it's not coming from the top down. The blink reflex actually starts at the outer corner of your eye, and then the lid sort of comes down and then goes up again. So it's like a zipper effect. You've seen the zips in pants. So the zip goes up and goes down. So you imagine your zipper coming from the outer to the inner side, and that's how it pushes this water towards the drainage system. Okay. So what is dry eye? Dry eye happens when there is not enough production of one of the three layers of your tear film. So whether that is your oil layer, your water layer, or the mucin, the protein layer, if there is an imbalance taking place in any of that, you will get a dry eye system. Okay. What are the factors that change how the tear production happens? Age. So as you get older, you'll find less tears are produced. Women, because of their hormonal changes, they have less production and more production happening at different times of the year. Medications, lots of medicines affect the tear film. So simple things like decongestant. Arey, I've got a cold, let me take a cold medicine. That cold medicine will dry up all the secretion in the nose, but will also cause a little bit of dryness in the eyes. So there are lots of different factors that change how our tear film works. Medical conditions, there are different kinds of thyroid problems, diabetes, and rheumatoid. These are the common ones that give rise to dry eye condition. But our environment, windy outside, dusty outside, very hot climate outside, these are things that will also affect how the tear film works, because the tear film, remember, it's got water, so it's going to start to evaporate. So there are all kinds of things which can do it. Smoke, just simple smoke. So somebody smoking in the room, that can also affect the way the tear film works. And the other big factor is staring at gadget screens and not blinking, using contact lenses. If you had some kind of laser surgery to remove your glasses, not at your age group, maybe a little older, after 18, people say, I don't want to wear my glasses. I'm going to have a laser surgery to remove the glasses. That has its own temporary situation of dryness that develops after a laser. But contact lenses, there are people who wear contact lenses, and they also are prone to getting dryness in their eyes. So what happens when we are reading? So when we read, the body has its own mechanism of allowing a focus to take place. In that focus process, your normal blinking frequency goes down. And remember, when the blink is not happening, the tear film is not spreading across your eye. So the tearing is going down. Okay. So this is how other factors of gadgets, we keep looking at our screens. What is happening when we're looking at our screens? Other conditions which can give rise to dryness are lots of other, medicine induced problems and things like that. But nutrition, very important. How does nutrition work? Remember vitamin A and what you are taught in school about how vitamin works for our body. Vitamin A has a very important role to play in our tear film also. It, apart from vision at night and the vision cycle in your retina, where vitamin A is necessary, you also need vitamin A for the skin. So the surface of your cornea needs to be nice and smooth, and that only happens if you take good nutrition. So taking lots of colored vegetables, colored fruits, you know what all contained vitamin A contains in that. So you must remember to take adequate nutrition also. Juvenile diabetes, systemic medicines, like I told you, things for blood pressure, all those will also give rise to dryness. And here are those environmental factors that I was talking about. Dry conditions, so dry climates like going in the Rajasthan area, very polluted environments. Again, they all affect our environment and therefore affect the way our tear film functions and works. Okay, so what are the symptoms of dry eye? Sandy gritty, it feels like there's something in the eye, redness, irritation, pain, you feel tired, you feel stinging or burning in your sensation in your eyes. You feel uncomfortable if you're wearing your contact lenses for very long. You feel, okay, I want to take my lenses off. This is not feeling comfortable. Episodes of blurring vision. Remember, I told you that tear film is very important for how we see. So if you're not producing enough tears, you're going to get blurring of vision. Decreased tolerance to attention. So you lose focus when you're working and you don't feel like looking at your screen. That's a big problem, isn't it? When we are working in school and school is going on and we're not comfortable looking at that screen all the time. So what is computer vision syndrome? There's another name for it. It's also called digital eye strain. So you're constantly focusing on this screen in front of you. You remember that when you're focusing, your blink rate also goes down. You're constantly reading on the screen. So all these factors give rise to a chronic fatigue in our eye. That fatigue has different parts to it. So there's the tear film, the way the lid works, the blinking is not enough. So the tears are drying and you end up with a kind of chronic dry eye that starts. Okay. Now imagine this statistics is from 2019, where we see that there's a lot of computer use taking place. Of course, look at if you look at the this axis, you will find that a lot of it is population generated. So where there is more population, obviously there will be more screens. But this is 2019. So imagine what happened in 2020 when all of us came indoors. We didn't have a choice. We were all sitting on screens. We're doing school from screens. We're doing work from screens. Everything is on screens. So the amount of internet use has gone up many fold in this last 1 year, and therefore computer vision syndrome or digital eye strain has also increased a lot in this last year. So computer screens, as you know, they're made up of pixels or tiny dots. They're moving all the time. And it is this, we don't really realize it when we're looking at a screen that this is happening, but essentially it is that constant refresh rate which also adds to the fatigue factor during computer usage. And remember, when you're looking at something, whether it's reading a book, whether it's looking at your TV screen, whether it's looking at your computer screen, anything that you start to concentrate on, the brain has a mechanism of automatically reducing the blink rate. So the blink rate goes down, and when the blink rate goes down, the dryness starts to happen. So here it is, laptops, televisions, smartphones, tablets, any kind of visual aid, all this, because we're not blinking enough, will add to the digital eye strain. So what are the symptoms? You get eye strain, sore, fatigued eyes. You say, my eyes feel tired, they feel stingy, I find it difficult to focus, getting a lot of headaches, I'm getting burning, itching, I'm getting irritation, and then also with the posture. Sometimes you're looking at a screen like this all the time, so you start to get a pain along the neck, the back of the shoulders also. So remember I told about blink rates. Blink rates are normal, 14 to 15 per minute, but during any form of focused reading activity, computer use or anything, that blink rate goes down tremendously. And what are the other factors that exacerbate or increase your dryness? So exposure to dry air, low humidity, and air conditioning. So if you're sitting under a fan, the fan is going at high speed, you're sitting in front of a air conditioner, whether you're sitting in the car with the air conditioner blasting in your face, all these things will change how the tear film works and therefore turn your eyes dry. Okay. People who travel a lot in aircrafts are known to be very dry. So look at that low humidity in an aircraft. They will always have more problems with dryness because they get a lot of tear evaporation and they also start to feel uncomfortable because of that. What are the possible problems related to when you have dry eyes? So you are at an increased susceptibility or increased risk of eye infections, because remember that tear film, apart from only water, it has a whole lot of other additives in it that protect our eyes. There are enzymes, there is other protective material in your tear film that protect your eye from a infection by bacteria, by viruses and all those things. So you are at an increased risk of infection. Damage to the eye surface. Remember when you get little something goes in the eye, how much water comes in your eye, because the body automatically tries to throw it out by producing lots of tears to try and wash it out. Okay. And when you have dry eye, the quality of your life automatically becomes very uncomfortable. So your everyday activities become very difficult to do that. How do you relieve yourself from dry eye? So people who use screens for a long time should do a eye test every year. As a child, as a growing young adult, you should also have your eye test every year to see whether you now need glasses, whether your eye muscles are strong enough, whether you need some form of exercise to improve your eye muscle strength. Also, we as doctors like to ask, how many hours are you on the screen? How many hours after you look at the screen do you look at your phone? Because we are all, remember, we're all at home nowadays. We're not allowed to go out. So what do we do? How do we talk to our friends? We look at a screen again. And another very important factor is what is the distance you keep between you and your screen. So that is very, very important in how it generates eye strain. Other factors that affect how you're working on a computer screen is also the environmental light. Poor light, bright light, light bouncing off your screen. So all this gives rise to glare. So when you have excessive bright light from a side window, it's going to give rise to glare. So there should be a good balance of the light in the room also. If it's too bright, reduce it a little bit. If it's too dull, improve the light so that you're not straining at the screen while you're working on a computer. Okay. So the other thing is, you sometimes say, "Arey, anti-glare screen, anti-glare screen." The newer devices have far better refresh rates on the screen, and the need for the anti-glare screen is less now. But if you're using a slightly older device, you may find that if you put a anti-glare screen, it's a little better. And glasses, anti-reflective coating on the glasses definitely does help. If you look at types of screens, LCD screens are better than those old type monitors that used to be desktop monitors. But a lot of us now are fortunate that we have computer laptops where the screens are LCD screens. They're far better than the old kind. Screens with high resolution. High resolution will give rise to more comfortable viewing comfort when you're viewing. Larger the display. So small, working on your smartphone with a small screen gives you far more eye strain than if you had a little larger handheld device, or of course if you're fortunate enough to have a laptop, is by far the best thing to work on. Keeping the brightness of the screen, that's the other important thing. The contrast between dark and bright. And if you look at this screen here, you can see a busy background makes it hard to read. Low contrast is hard to read. But the best contrast you get is black and white. Blinking is also very, very important. So remember to do blinking when you're working on a computer screen. You must remember to blink every few minutes. So we use what's called the 20-20-20 rule for computer use. Every 20 minutes, look 20 feet in the distance. Therefore, you relax your accommodation and you, for 20 seconds, where you even blink 20 times. So blink 10 times, blink 20 times, blink hard. So close tight, squeeze tight, open, do things like that. This helps to refresh your tear film and make your eyes comfortable again. Exercise your eyes. So look away, relax. Relax your eyes. Every time you're working long, you must remember to give your eyes a short relax. So get up from your chair, maybe you go around once, sit again, do some muscle exercises on your shoulders to take the strain away from your shoulders because you're looking at a screen all the time. Remember to blink a few times and close your eyes, open eyes, look in the distance and relax your eyes. So these are the different things to do. Okay, remember to take those breaks. So when you take the breaks, it makes it better. So when you're working at your workstation, rather than sit on a bed, sit uncomfortable, preferably sit at a table. Use good light. Keep your papers that you're looking at to the side. Look downwards slightly at your screen. If you look straight or if you look upwards at your screen, it's very uncomfortable. It gives rise to more eye strain. So how to adjust your environment where you're sitting also is important. If you've got a table lamp on the side of your table, make sure it's not putting glare on your screen. So adjust the table lamp also in that area. And you may have heard about computer glasses. So that's one thing. People like to use computer glasses where they have anti-reflective glasses on it. Or sometimes people are also talking about blue light glasses. So blue light, why blue light? Because all screens, they emit a blue light. And there is this thought that if you use lenses with blue filters, you'll be protecting your eyes. You don't really need to do those blue filter glasses. So what is more important is remember to take the breaks. So take the break, close your eyes, blink frequently, keep good light in around you, then needn't spend on the blue lens glasses. But anti-reflective glasses, yes, you can definitely consider those. What else to do? Good nutrition, take flaxseed oil, fish oil, almonds, because just remember about the oil in your tear film, drink lots of water, remember to have your vitamins, which comes from all the green leafy vegetables, from all the colored fruits that you eat, and don't take too much red meats and very high carbohydrates. So how can you tell that where you need to see a doctor now. This is not working for you. Tried everything at home, it's still not working. So when you start to get red, painful eyes, it get a lot of sticky discharge, you get flaking on your lids, or any such situation, then you need to go see the eye doctor, who will then give you proper medication for it. Okay. So in summary, lubrication, nourishment to the eyes, computer vision syndrome. To avoid dry eye, effort should be made to produce your tear film adequately. Always remember, you should contact a doctor if you think that this is not going well for you.
Thank you, doctor. Thank you for your wonderful insights. I'm sure the students have already had a brief idea about dry eye and all the things that has to be taken care of. Thank you so much, doctor.
Anyone with questions?
So anyone, if you want to ask any question, you can simply unmute yourself and go on to ask your query. All right, ma'am. Meanwhile, we have received few questions in the chat box.
Yes.
One of it says, okay, ma'am, when we see the screen from a long time, we get headaches. Is it somehow connected to dry eye?
Not so much. It could be partly dry eye, but very often it is because of poor muscle balance, what we call convergence insufficiency. And you may have seen on the internet, or someone may have taught you about the pencil exercise. So one of the ways to reduce your eye strain is to also do what are called pencil push-ups. So you hold your pencil at an arm's distance, okay? Look at the tip, focus on the tip, count to 5, bring it closer. Again, look at the tip, focus on the tip, count to 5, bring it closer. Do the same thing and keep getting it closer until you get to the point where the tip is not very sharp or in focus. At that point, you take it back and you go back. So this is called a pencil push-up. When you get very good at doing it, you will find this focus or defocus point, which was earlier here, starts to get closer and closer to your eye. When you are doing this exercise, it is an exercise to improve your convergence, and this will help to reduce some of the headache that you get. The other thing, remember, look at your environment, look at how you're sitting, and also get an eye test. Do you need glasses? That could also be a reason why you're getting headache. So all these factors have to be looked at.
All right, ma'am. Yes, anyone from the
Somebody asked, does the cornea never grow from infant to old age? The cornea pretty much at birth and within the first 2 years has reached its size of about 11 millimeters by 12 millimeters size, and that pretty much stays throughout life. It is the back part of the eyeball, which will grow with time. The front pretty much stays the same.
All right, ma'am. Ma'am, is it also the same reason why we see most of the students who develop myopia, they go on increasing their eye power later up to a certain age of time?
Yeah, so when you have a tendency towards myopia, you will notice either the myopia starts at 7, 8 years of age, or then when you hit your teens, 12, 13 years of age, when you grow. So when you grow, your body is growing, your eye is also growing. It's the back part which is growing. Remember that picture I showed you of the eyeball? So it is the back part mostly which is growing. And as the back grows, you know the physics of focus, you will find that the focus is not happening on the retina. It is happening in front of the retina, and therefore you need those glasses, those concave glasses, to bring the focus back on the retina. So as we grow, the eyeball also grows, and therefore the power keeps growing. What are the factors that make it worse? If you read in poor light, if you hold the book too close to you, so you have good working distance, you lying down on the bed and reading. So all these factors make it worse. Therefore, to have your eye test, to have regiment how you read, that becomes important.
All right, ma'am. Ma'am, there is this question from Prachi. I think she wants to ask a question. Yes, Prachi, you can unmute yourself and go on to ask your question.
Ma'am, I want to ask that sometimes when we uh,
Yes, Prachi. I'm sorry, ma'am, we have disconnected.
Okay.
Yeah, we can't
So
hear.
old people lose their eyesight very commonly because of cataract developing in the natural lens of the eye. When you get opacity in the lens of the eye, that is the most common reversible form of blindness. The other problem that happens when we get very, very old, that retina that we have, that also gets a little old. It starts to get age-related degenerative changes. So those are the two common reasons why people start to lose sight in old age. One is recoverable by doing a cataract operation, and the age-related ones, you have to just have good nutrition, and some people benefit by certain procedures, not all. What are the symptoms of dry eye? Burning, watering, itching, irritation. All these are symptoms of dry eye. There's a foreign body sensation in the eye. It feels like something has gone in your eye. So the eye keeps getting irritated, and therefore when there's irritation, remember there's a reflex that starts in the eye, and there's water production. So you swing from feeling irritated to feeling very watery in the eye. Then again, you get very irritated, very watery. So it's actually like a curve going up and down. It's a sine curve of feeling comfortable and then getting irritation, then having overproduction. Therefore, when we say use some eye drops, we create a balance in that environment, and that helps that eyes to feel more comfortable.
All right, ma'am. Yes, Avni, I can see you raise your hand. Do you want to ask any question?
Yes, ma'am. Good morning, ma'am.
Morning.
Ma'am, I have a doubt that when we see some old people in their eyes, we see something very thin and which is like some fleshy substance. Ma'am, I'm confused that what is that?
So is that on the white part of the eye? Do you see it on the white part of the eye? So if you see it on the white part of the eye, that is again a sign of dryness. Those are technical things. Sometimes there's a little fleshy membrane growing in front of the eye that is called a pterygium, that is commonly seen in very dry climates. And so is the other small fleshy white thing, which is called a pingicula. Again, that is a sign of dryness. And remember what I said, as you get older, your tear production goes down, and therefore you sometimes need to use a lubricating eye drop.
Thank you,
So
ma'am.
these are harmless things. Some of them, if they are progressive, they benefit by surgery. Otherwise, they're usually very harmless things, and there's nothing to worry about that it's forming there.
Thank you, ma'am.
Thank you, Avni.
What happens in cataract? Basically, your natural lens, which is crystal clear, starts to change its nature, and it gets opacities in it. It becomes cloudy, and so the light doesn't pass through through that, and therefore you start to see very, very blurred. There's a question from Akshita about irritation, pain, and red eyes. This could be a little bit of dry eye. It really depends on how many hours you're spending on your gadgets. So it's very important for you when you finish school to actually shut the computer, not look at the screen. I know all of you meet your friends virtually by opening a screen again, but you should try and limit how much you look at a screen. Do other things, do art and craft, read a book, try something else, try and exercise at indoors if you can, do different things, but try and get off the screen as much as you can. It's all about discipline. Early dry eye, you can even wash your eyes with cold water. That also works very well. You don't really need an eye drop then. You can occasionally you get dryness in the eyes. Just use cold water, wash it well, and you'll feel comfortable after that. And remember to blink. When you're working at a screen, remember to blink. If you keep blinking, there'll be enough tear production to that will take place that will keep your eyes comfortable.
All right, ma'am, that is it, I guess. We have not received any further questions. And there's this last question if you want to address. It says, what is the average time we can spend on digital screens?
I don't think you should be spending more than a couple of hours if you can. So school itself nowadays is 4 to 5 hours of screen time. What is it nowadays? How much time are you spending on the screen? So over and above that, if you just do another 30-40 minutes is more than enough. But given a choice, don't spend more than 2 hours on a screen every day if you can.
Right, ma'am. So, ma'am, that's it. Thank you for addressing our queries and beautifully telling us what to do and what are the precautions that we should take, especially in the time of COVID when we actually cannot avoid screen time.
Yes, we cannot
Thank you
avoid
so
screen, so we have to learn to deal with the screen and to try and reduce the problems that it generates.
Yeah, right, ma'am. So, ma'am, thank you. Thank you again.
Thank you.
Thank you once again for your wonderful insights. And thank you to all the students who have joined in the session. It was great interacting with you all. Thank you so much.
Thank you.
Thank you,
Thank you.
ma'am.
Bye-bye.